Hello everyone and welcome to Know Your Drug, the ultimate destination for all things of health and wellness from the fascinating world of pharmaceuticals. We are here to guide you on Dapagliflozin Tablet, exploring the various aspects of dapagliflozin, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Dapagliflozin Tablet. Dapagliflozin is a medication used to treat type 2 diabetes mellitus. It works by reducing the reabsorption of glucose by the kidneys, which leads to increased glucose excretion in the urine. This helps lower blood sugar levels in people with type 2 diabetes. Dapagliflozin is primarily used to improve glycemic control in adults with type 2 diabetes mellitus. Dosage of Dapagliflozin Tablet. The dosage of Dapagliflozin Tablet can vary based on individual patient factors, medical history, and the specific treatment plan determined by a healthcare provider. We can provide you the general dosage information for dapagliflozin. The typical starting dose of dapagliflozin is usually 5 mg taken orally once daily. In some cases, your healthcare provider may increase the dose to 10 mg taken orally once daily if the initial dose is not providing sufficient blood sugar control. Dapagliflozin can be used as a monotherapy or in combination with other antidiabetic medications. Dosage adjustments may be necessary for individuals with impaired kidney function. Dapagliflozin is primarily eliminated through the kidneys, so proper dosing is important to prevent accumulation of the drug in the body. Dapagliflozin tablets are typically taken orally with or without food. It's important to follow your healthcare provider's instructions on when and how to take the medication. Mechanism of action of Dapagliflozin Tablet. Dapagliflozin is a medication that belongs to a class of drugs known as sodium glucose cotransporter 2, SGLT2, inhibitors. Its mechanism of action is centered around the kidneys and plays a key role in reducing blood sugar levels in individuals with type 2 diabetes mellitus. Here's how dapagliflozin works. Normal glucose reabsorption in the kidneys. In a healthy individual, the kidneys filter blood to remove waste products, including glucose. Glucose is then reabsorbed back into the bloodstream through a protein called SGLT2, which is primarily located in the proximal tubules of the kidneys. Inhibition of SGLT2. Dapagliflozin works by inhibiting the action of SGLT2. By doing so, it reduces the reabsorption of glucose in the kidneys. This means that more glucose remains in the urine and is eventually excreted from the body. Increased glucose excretion. With the inhibition of SGLT2, the kidneys allow more glucose to be excreted in the urine. This leads to a reduction in the amount of glucose circulating in the bloodstream. Lowering blood sugar levels. By increasing the excretion of glucose, dapagliflozin helps lower blood sugar levels in individuals with type 2 diabetes. This effect is independent of insulin and does not rely on increased insulin secretion or improved insulin sensitivity. Weight loss and other effects. Dapagliflozin's mechanism of action can also lead to some additional benefits. Since glucose is being excreted, individuals may experience a slight reduction in calorie intake, which could contribute to weight loss. Additionally, dapagliflozin may have beneficial effects on blood pressure and cardiovascular health. It's important to note that dapagliflozin is not recommended for use in individuals with type 1 diabetes or in cases of diabetic ketoacidosis. Side effects of Dapagliflozin Tablet. Dapagliflozin is generally well tolerated by most individuals, but like any medication, it can potentially cause side effects. Here are some common and potentially serious side effects associated with dapagliflozin. The common side effects are genital infections, urinary tract infections, increased urination, dehydration, hypotension, and ketoacidosis. Some serious side effects are kidney impairment, hypoglycemia, and Fournier's gangrene. This list is not exhaustive, and the actual side effects you experience may vary. Always consult your healthcare provider for personalized medical advice and guidance. Important advices for using Dapagliflozin Tablet. When using Dapagliflozin tablets, there are several important pieces of advice to keep in mind to ensure safe and effective use of the medication. Take Dapagliflozin exactly as prescribed by your healthcare provider. Do not adjust the dosage or stop taking the medication without consulting your doctor. Dapagliflozin tablets can be taken with or without food. Follow your healthcare provider's instructions on when and how to take the medication. Dapagliflozin can lead to increased urination, which may increase the risk of dehydration. Drink plenty of fluids throughout the day to maintain proper hydration. Continue to monitor your blood sugar levels because Dapagliflozin is intended to help lower blood sugar levels, but it's important to keep track of your levels to ensure they stay within a healthy range. Follow a balanced and healthy diet as recommended by your healthcare provider or a registered dietitian. Engage in regular physical activity as it can help improve insulin sensitivity and overall glucose control. Inform your healthcare provider about all other medical conditions you have, especially kidney problems. Dapagliflozin affects kidney function. Excessive alcohol consumption can increase the risk of dehydration and may affect blood sugar control. If you experience symptoms such as genital infections, urinary tract infections, or signs of dehydration, excessive thirst, dry mouth, dark urine, contact your healthcare provider. Attend all scheduled medical appointments, including follow-up visits with your healthcare provider. Regular monitoring of your diabetes and overall health is important. Inform your healthcare provider about all the medications, supplements, and over-the-counter drugs you are taking. Some medications may interact with Dapagliflozin and affect its effectiveness or safety. Remember, Dapagliflozin is just one part of a comprehensive diabetes management plan. It should be used in conjunction with a healthy lifestyle that includes proper diet, exercise, and regular monitoring of your blood sugar levels. Always consult your healthcare provider for personalized advice and guidance on using Dapagliflozin or any other medication. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Dapagliflozin Tablet. Remember, knowledge is power, and being well-informed empowers you to make